Good afternoon, all. This is Hannah White, and we are here for the biweekly webinar, the All In for Kansas Kids biweekly webinar for November 30th, 2022. We're going to do things a little bit out of order today, just because we have some scheduling constraints. So we're going to start with an update about the PDG Planning Grant for 2023. That's the Preschool Development Grant, Birth to 5, which we're currently funded under. And then we're going to hear about some general updates, just things that are happening in the system. And then we have a presentation about quality subgrants and how some of those recipients are doing, some of the innovative ideas that they are bringing to the workforce, and just kind of giving you an idea of where we're at with those since we're kind of wrapping the subgrants up. Following that, and it didn't make it on the agenda here, we're going to talk a little bit about zoning, and I'm going to try and see if you can help me visualize some of the issues that people in the field deal with when they have to comply with zoning regulations that may or may not be different than childcare licensing regulations. So with that, I'm going to go ahead and introduce Sara Gardner with the University of Kansas Center for Public Partnerships and Research. And she is going to give us an overview of the planning grant that we just applied for.
Awesome. Thank you, Hannah. As Hannah said, I'm Sara Gardner. I'm with KU-CPPR. I am the grant coordinator for the current preschool development grant that the state of Kansas has. It's a 3-year grant. It's an implementation grant that started in April 2020, and we are coming up on the end of that grant next April. So that's my role. Kansas was one of the states invited to apply to another round of preschool development grant funding. That's what the PDG stands for. We were eligible to apply for a new planning grant. So this would be similar to the work that was done back in 2019. If you were around back then, we did a large needs assessment, comprehensive needs assessment. That's the year we wrote the All In for Kansas Kids strategic plan that we are currently working to implement now. So the federal, the ACF from the federal government is opening another round of planning grants. We were invited to apply. It's quite competitive, but we were very excited to put that submission in. So I'm here today to just walk you through what we wrote in that opportunity and let you know the timeline. So just a quick overview of the intent, and I put this in here because of the nature of a planning grant. It's a little bit smaller dollar amount, and it's really about updating your needs assessment and updating your state strategic plan. So there's not a lot of direct funding available to communities or to programs. It's really about making sure that we are capturing needs and sort of planning to continue supporting the early childhood system in Kansas. Next slide, Hannah. So this was due November 7th. We submitted on time. The Children's Cabinet was the designated lead as they are the lead for the current PDG as well. But of course, like all the stuff we do in Kansas, it's a collaborative approach with the other agencies who primarily lead the early childhood work in Kansas. So of course, that's the State Department of Ed, Department for Health and Environment, and Department for Children and Families. This is a 1-year grant, so it actually starts December 30th of this year and run through the December 29th of next year. There are 10 awards total, and the grant amount is up to $4 million. We are one of 7 states eligible for this. I also want to just note, if you follow federal grant notices that come out, you might have seen another PDG implementation grant opportunity. Kansas is not eligible for that because of our current grant. So just a notice, if you see those 2 different announcements, just know there are 2 parallel grants out there for states to apply for. The grant structure, as I mentioned, is identical or very similar to the 2019 planning grant that we did. So we kind of have to follow the guidelines that the grant notice sends out. Activity 1 is about updating our statewide needs assessment. We've been doing that at a smaller scale each year of our current PDG, but we will do a bit of a larger data collection effort around our workforce, around what families needs, around our childcare sector. So should we get funded, we will be coming back to communities and coming back to programs to say, you know, what is the state of state? What are the needs that you are having in the early childhood system? From that, we will generate a new strategic plan. It will be the All In for Kansas Kids strategic plan. It will just be an update to our current work, as well as extend through another 5-year timeline. So we want to make sure that we are continuing to build on the great work and the great planning that has already happened, but just give us a further time horizon out. Activity 3 is about maximizing parent and family engagement. So we hope to do 2 different family engagement activities with this. One would be to utilize parents to develop ideas for how we might broaden awareness around the need for developmental health. So Kansas has established a statewide Ages and Stages questionnaire enterprise account, the ASQ, which is a critical tool to help support families and the developmental health needs of their littles. And so we want to know what parents want to know about developmental health, and how can we use family voices to get the word out more. The other family engagement activity would be around mapping enrollment for different services in the B2 5 mixed delivery system, and making sure that we are identifying pain points when it comes to enrollment that families are experiencing, and how can we minimize those pain points? How can we align services at that enrollment point to make things easier for families? Activity 4 is supporting our B2 5 workforce and disseminating best practices. So we'll be looking at how we can infuse some different approaches to recruitment and retention of childcare providers, home visitors, family support professionals, and others who work in the early childhood space. So we'll be trying to identify some different pilot projects and sites that we can infuse some of those best practices. And supporting overall quality improvement. You'll see a note here that we can't start that activity until we have our strategic plan and needs assessment approved by our federal partners. So this is the smallest activity in the grant. And for this, we would want to be sharing the Kansas Early Learning Standards, as well as the Kansas Parent Partnership Standards. More broadly, translating those standards into different languages and making sure we're printing copies and making them available to others. Just as a note, we are a current PDG grantee, so we did a lot to reference our existing work and build on the lessons learned, particularly during the pandemic. Actually just went through all of this, I realized, so apologies. So I'll just touch on these real quick. Existing needs assessment, we'll do a little bit more art tomorrows, and we'll do some community engagement sessions. I kind of spoke to some of this before. And then the strategic plan. One thing I didn't note here with the strategic plan is bullet 2 here. You'll see a little note about agency alignment gap analysis. So this is just to make sure that our early childhood system at a state agency level is really aligned and working in the best way possible. So we will be doing some public engagement sessions to see where do we have misalignment at a state agency level, and how can we do better to support children and families with that. And there will be lots of opportunities when we write the strategic plan to get feedback on draft language and making sure that it's feeling like a plan that is accessible and meaningful to both Kansas providers and families. And just as I noted, we'll do the family engagement activities around developmental health. We'll do family engagement activities around enrollment. We'll do some pilot sites around workforce best practices, and then of course disseminate the KELS and the Kansas family engagement and partnership standards. So apologies for kind of mixing that up and not giving you guys a lot of time with those slides. I think that's all I have on this, so I will be available for a few minutes for any questions if folks have it. We should know in the next 2 weeks or so if we are awarded the grant. If we're not, we still have our current PDG that runs through April, and of course we have the All In for Kansas Kids strategic plan to guide our activities, and we'll continue the great work that the system is already doing. So all the initiatives that are going, the great work coming out of the different state agency partners at KDHE and DCF with the relief funding. Well, all of that will continue. So a lot of good momentum. This would be a nice cherry on top to update needs assessments and update the strategic plan. So thanks for the opportunity, Hannah.
Thank you. And thank you for always coming on and giving us the lowdown of what's going on in the state. We appreciate you, and good luck at your 1215. So with that, we're going to go ahead and start just our regular updates that we typically present to you. Things that are happening in the system that you may or may not know about. This is a really big one here. Early childhood block grants are open for application, and the submission deadline is December 16th. So if you are a program that is interested in applying for the early childhood block grants, which is a really significant funding stream, part of the Children's Initiative Fund, which is the big bucket that the Kansas Children's Cabinet and Trust Fund allocates and monitors. If you're interested in doing that, I would encourage you to go on our website, which Megan has a link in the chat, and just look through the RFP. It's incredibly helpful, step by step. There's a lot of great tips, but it's a pretty easy process based on the way that the RFP is outlined, and we have technical assistance available. Applications are going to be submitted through the Kansas Common App platform, which is what we used last year. So some of you may be familiar with that from a different funding application. And again, that submission deadline is absolutely no later than December 16th at 5 p.m. So a couple things I want you to keep in mind when we think about ECBG funding is that it's intended to be supplemental. So one of the things that reviewers are going to be looking for is ways that applicants are able to sustain their program without this ECBG funding, because it shouldn't be the primary source of funding. They have to also demonstrate, these programs have to also demonstrate that they're actively seeking other types of funding and community support before requesting this funding. And then a few more things. So as a reminder, and I'm sorry, I have 3 screens, but as a reminder, eligible programs are 501c3 organizations in Kansas, county and city governments in Kansas, and then unified school districts or USDs. And then a few things that we're looking for in those strong proposals, just to make you as successful as possible, is again, really looking for the way that existing resources are going to be mobilized in your community. So partnerships, existing funding sources, things like that. Being able to articulate how existing community needs data supports your request for funding. And that could be either through the needs assessment that we did at the statewide level, but just being able to really evidence the need in your community. And it's certainly a focus on outcomes. If you've been an ECBG grantee before, you know that outcomes are incredibly important. There's a variety of measures that we use. And so that's a part of being a grantee, is being able to show progress through measures. The other 2 things that are really important is increasing the availability or capacity of that high quality childcare in your community, and then having a commitment to, again, evidence-based practices and methods that are really going to support high quality care. So if you are a program that's eligible, and again, remember, you do have to be USD, county or city government, or that 501c3, please check out the RFP. It's very thorough, and it should lead you through the process. If you have questions, there is technical assistance available. And then again, that's going to be through the Kansas Common App platform. All right. We also have coalition building funds available through Child Care Aware of Kansas, which is really interesting. And this has been going on for a little bit, but I don't think we've talked much about it in these webinars. So eligible Kansas communities are able to apply for up to $2,000 for that initial support to start a child care or to support child care coalition building activities. And then from there, eligible existing coalitions can request up to $45,000 to implement those plans. So really, really unique opportunity. If you're interested in grassroots types of things and you're interested in activism, this is a really great opportunity. If you have questions, or if you have questions about the eligibility requirements, please visit the Child Care Aware website. Funding is going to be available through June of 23. It's first come, first serve, so they're going to continue to fund until they run out of money. And then we always have great technical assistance from Child Care Aware. So if you need help, they will help you. All right, just another update on our workforce bonuses. So we're still in the relative care provider application window. Or anybody who has not gone through the application process. So if you are one of those 20,000 eligible childcare staff in Kansas and you've not signed up to get your bonus, been involved in this bonus process at all, it's still open. You can still take advantage of it. But right now we're currently in the relative care provider section for applicants. And again, this is a pretty big infusion of funds, one-time funds to, I believe the estimate that we got, we're not at 20,000, but we did have DCF staff come on last webinar and tell us about the reach that they had. I think it was 12 or 13,000 is what we've been able to reach thus far and allocate these funds. So for those of you who may be part of the Kansas Parents as Teachers Association, they've got some really great trainings available coming up. So each month it's going to be a different topic. In December, they'll be talking about positive supports, impact on family well-being. January, they're going to discuss oral health. And then in February, which the date is to be decided, we're going to discuss racial equity and a foundation for understanding. So these training opportunities are free for CPPR members. So if you are and you're interested, follow the link to sign up, and we will notify you when we get that February date. I also just wanted to highlight, as we're coming into the end of the year, a really wonderful resource if you're interested in diversity, equity, and inclusion. So the Child Welfare Racial Equity Collaborative is a really wonderful statewide effort that has helped us kind of start the conversation and continue the conversation about equity, especially in the childcare space. So they have recordings available still, even from 2021, but I wanted to highlight for you the recordings and the sessions that they did in 2022 because they were really excellent. They're still available on the website. So I would recommend checking them out if you're interested. I don't know when they'll be taking them down, and we don't have any new offerings, or we don't have information about what they'll be offering for 2023 yet, but again, those two are really great. So, all right, with that, I'm going to introduce Katie Hart, and Katie Hart is one of our friends from KU, Center for Public Partnerships and Research. She's going to give us kind of an overview of what's been going on with the quality subgrants, which, as you remember, were initially applied for and then funded in 2020. And so we're coming up to the end of these funding these subgrants with the cessation of PDG April of 23. So Katie, take it away.
Great, thanks so much, Hannah. Hello, everyone. I'm Katie Hart. Part of my role at the Center for Public Partnerships and Research is to provide support to the quality subgrantees. Along with Megan Broha, I should mention Megan does a ton of the invoicing, support, and processing, so couldn't do this without Megan as well. So as Hannah alluded to, the subgrants were first awarded in 2020 and are funded through the Children's Cabinet as a part of PDG to address some specific goals related to childcare that I'll get into in more detail in a minute. But basically, each subgrant that was awarded had the opportunity to renew for the subsequent year up until April of 2023 when the PDG grant period ends. With the exception of kindergarten readiness subgrants, which were awarded to new grantees each year. So the goal of the subgrants is really to help service providers address childcare challenges in their communities in a way that is very locally driven and flexible, with an emphasis on community partnerships, supporting children in transitioning to kindergarten, and being able to share ideas to scale or leverage across the state, across Kansas communities. So to date, 86 subgrants have been awarded across these 5 categories. So increasing access to childcare, increasing access and availability of childcare in rural communities, connecting families to services, supporting children transitioning to kindergarten, improving the quality in early care and education system. So like mentioned previously, the majority of the projects are multi-year and run through April of 2023 in alignment with PDG. Okay, so now I'm just briefly going to run through each of the said categories and just talk a little bit about what some of the subgrant work looks like in each of these categories. So in terms of subgrants for childcare access, the goal is to increase the availability of high quality childcare for specific populations, which are infants and toddlers, low income families, migrant families, children with special healthcare needs, children experiencing homelessness, and children involved with foster care. So this takes a lot of different forms. I will say a lot of the efforts here have been related to staff retention, increasing quality and access around maintaining slots, offering staff retention bonuses, investing in training and development for staff, being able to provide funding for expanded or non-traditional hours of care, to better address the needs for these particular populations. For subgrants for rural childcare, this one is to address challenges that rural childcare providers face and to invest and retain in individuals entering the early care and education workforce and hoping to retain them. And so some of this could look like a number of the subgrantees are home childcare providers themselves or small providers. So being able to support their efforts in maintaining slots and offering competitive non-traditional hours. And then some larger organizations maybe providing support to new childcare providers in their area, walking them through licensing, et cetera, to expand the number of slots that are available in the area. Connecting families to services is really about enhancing infrastructure, increasing collaboration, and developing awareness campaigns to help families get connected to the services they need. So a lot of these subgrants center around increasing community awareness. So hosting events, attending community events to connect with families who are particularly in need of services, building up an IRIS network to give and receive referrals, all the sort of peripheral pieces around getting families connected to what is available in their community. Kindergarten readiness, the goal is to invest in programming and support for the successful transition of children from early childhood settings into kindergarten. So a lot of these, and again, these were the subgrants that are just 1 year. A lot of early literacy programs, supplemental educational programming, a lot of those took place like over the summer before the kindergarten year started, like a kindergarten jumpstart or a camp. And programming that promotes an ongoing relationship development between school districts and early care providers. And then for improving quality of care, this could take a lot of different forms, like subgrants requesting funds to enhance tangible resources and supplies to improve quality, or investing in programming around like mental health or social emotional learning. So this could look like going through a training for a specific social emotional learning program or a specific, STEM related classroom toy, but really focusing on that quality of care and experience for children in their care. And then just really broadly, some common themes and activities funded that we see with the subgrants are really focusing on that capacity and quality of childcare, whether that's, being able to offer expanded hours, increasing awareness of resources, really focusing on staff retention. I do think that there have certainly been some challenges related to, hiring and staffing and things like that. But the purpose of this funding was also to be flexible. And so we've seen a lot of pivoting and, that flexibility demonstrated related to how plans have played out, but a lot of success in being able to address overarching goals that the subgrantee was looking to achieve. So I'll just close with a note from one of the grantees. In a recent report, a grantee had said that being able to invest in staff training and development was not only beneficial, from the information shared, but the morale boost that the staff felt from being invested in and really being treated like professionals. So it had really been a bright spot for them. So that's all I have. Thank you so much. If you have any questions or need any support related to subgrants, feel free to reach out. Thank you.
Thank you, Katie. We appreciate having you on, and I look forward to hearing kind of more about how we can highlight some of those subgrantees and see what they're doing in the spring. We've had a number of quality subgrant or grantees on our bi-weekly webinars, and it's been really, really cool to see how innovative they've been and the great ideas they've come up with. I think one of the recent ones that we had was the Shawnee County Early Childhood Training Center, which was, I think, a subgrant out of Child Care Aware. And that was just very interesting because we know that communities are incredibly unique based on what resources they already have. And so it's been great to see communities be able to build up a product using a moderate amount of funding that may not be, you might not be able to replicate it somewhere else just based on the unique situation. So I love hearing about these subgrants, and we'll be sure to bring these back in the spring and highlight some great things that our workforce is doing. So thanks again, Katie.
Yeah, we'd love to do that and actually have some subgrantees themselves talk about the success of their subgrants. So happy to do that.
Absolutely. Okay, so this is kind of the interactive part of the conversation. Feel free to come off mute, raise your hand, use the chat. But I really would like to have kind of a exploratory conversation about how zoning can affect childcare. We know anecdotally that it can create a lot of barriers because individual communities are able to have different zoning regulations than what's set forth by the Department of Health and Environment, which we know handles licensing and regulations. So if you have a story of maybe a barrier that you had to encounter, or a personal experience of getting through this, or maybe just being dissuaded from getting into childcare at all because it was too difficult to navigate the process with your local municipality, we would love to hear about it. We know this is an issue. We know, so much so that it's in our strategic plan. So here in Quality and Environments, of course, we call out how important it is to try and tackle this specific problem. I know that I've heard specifically about homeowners associations sometimes being an issue because a HOA can create a rule that supersedes any local ordinances or regulations. We also know that some zoning regulations can dictate what use is appropriate, and that variations of childcare programs are not acceptable in some cases. So that's a real barrier for somebody who's trying to start a childcare program and increase capacity across the state. So as I talk, if you have something that you'd like to share, I would love to hear your story, or you can also put it in the chat, like I said. So this is kind of why it matters. And I'm going to be honest, taking this deep dive was actually really frustrating. For somebody, I pride myself on being kind of a, like a private investigator. I can find whatever I need to online. This was incredibly difficult. It's really hard to find zoning information by county, or especially small towns, online. It's hard to interpret. And I feel like I didn't walk away 100% understanding what the firm rules are. So I can't imagine how difficult this would be for somebody trying to start a business, but it matters because there's so much variance county by county. It also creates barriers, as I said, because regulations about zoning can be different. They can be less than the actual KDHE approved ratios, not ratios, but complete capacity. Which creates another problem, because if people call licensing and they want to try and work through this process, licensing isn't able to help them because it isn't a licensing issue, it's a local issue. So people just end up kind of getting the runaround, and it's very discouraging. We already talked about how it can restrict the total number of children that are allowed in a child care program. And I haven't heard this problem as much with center-based care, but I'm sure it is still a problem because zoning regulations have to be followed to start a new business, and you have to be compliant depending on the number of children you want in that child care center. But I know that it really does severely affect family child care. So in my research, I looked at a few counties and did what I could to find zoning information online. And one of the things that I found was an actual interview that was done by KMUW in Wichita, and they interviewed Tanya Bullock, which, if you know Tanya, it was really cool to see her name there. She, as an aside, I believe she was also recently promoted to executive director there at Child Start, so give her congratulations if you see her. But this is what she said about it at a recent, I believe it was a city council meeting, when they were proposing a change to the city of Wichita. So it wasn't Sedgwick County, it was actually city regulations. And if you're curious, because we did talk and I wanted to see if there's been any progress made, as you can see, this is from September. She said, yes, it was approved unanimously at that point, but it needs to continue on to the commissioners. So this is in progress. They're trying to change this right now in Wichita. But she says that in Sedgwick County, at that point in time, they were only meeting 38% of the demand for childcare. Okay, so we know that that's can be reflective of many other counties across the state. Can be worse, can be better. But if those programs were able to increase their capacity with the zoning regulations, so not even the KDHE regulation, because they're in compliance with the KDHE regulation. But if they were able to modify that city regulation, it would significantly increase the capacity for that area. And Wichita, we know, is like, Sedgwick County is one of the most populated counties in our state. So we're talking about a really high number of children. And I love that, Tanya fought for this, and people like Tanya keep fighting for this because that's what it's going to take independently in each of these communities. But it's a little frustrating that we can't approach this collaboratively and kind of figure out some basic ground rules that would help providers navigate the process. And then I also reached out to Derby, Kansas, just kind of, I heard an interesting story, and so I wanted to follow up on it. And again, let me reiterate that, like, reading through these regulations is not my thing. I think I saw Amanda Peterson on here, so I think she loves stuff like that. But I think the majority of us would rather not painstakingly control F to try and figure out what we're looking for. But Derby, Kansas has kind of and I'm sure it's probably the same way across the state, but they have a rule about actual occupation. So if you are, let's say, somebody who, whether or not you're a homeowner, if you want to lease a property, rent a family home and operate a family child care program out of it, you can't do that based on zoning regulations set by the city. So they have actual municipal codes that say you cannot do that. There has to be certain occupation that's taking place in the home in order for it to be used for a private business or a family child care program. So I thought that was really interesting. And I would assume that there are rules like this across the state that restrict people using rented homes as a way to run a business, which creates some equity issues because we know the overhead to do it a different way, maybe purchasing a home, purchasing a building and creating it and turning it into a center. That's a real equity gap for people who aren't in the position to do that. So I thought that example was kind of unique. Just so overall, these are kind of the barriers that I feel confident about and I can find evidence for. Like I said, so we know that some HOAs actually just ban childcare programs, just say you cannot run a childcare program out of your home. Shawnee County, for example, there's restrictions about the noise. So because of the noise that could come from a childcare program, there's restrictions about when that childcare program can operate. which, I mean, makes sense. But then if we consider those providers that are trying to offer non-traditional hours, maybe for public servants or those in the medical field that work, 24 hours a day, that's a barrier if a childcare provider can't run their program in non-traditional hours. So I'm going to stop and pause here, and I just kind of want to know if are there any other specific examples of zoning barriers, or anything that we're not seeing, any other large buckets of barriers that we are not seeing yet. This is work that I think we're going to continue to try and chip away at. But because of the uniqueness that every community can make their own rule, it's a little bit tricky to navigate that from a systems perspective.
Hey, Hannah, it's Logan. I had, one story from a community that we had visited. We were talking to folks in Kingman, and they had brought up how, and I'm not sure exactly, I think it is connected to zoning, but they had talked about for family providers for in-home, that if they were, it's kind of related to that home occupation rule of where there were a few providers that were wanting to start up in-home childcare in a rented home that wasn't a home that they were dwelling in. And they could still do it, but landlords were not interested because of the property tax increase that they would have because of it not being considered in-home. So I'm not sure what to your point about it being hard because there being so many different municipalities across the state and all the varying there. I'm not sure if that solution is like I know previously that people had attempted to advocate for like a complete property tax, or not complete, but just like a reduction for all in-home providers. But this one seemed even more specific, like kind of more unique in that it's just kind of a cost barrier for in-home providers that aren't providing in their actual home. And then the only other thought that I had would be, are there any counties or cities that you think have like good modeled zoning laws for childcare, just to be, maybe that could be helpful to share with communities that face this barrier of like, all right, well, you all have a bad structure. Here's what a good zoning and like pro childcare zoning laws look like. That would be something of interest to me, but I'm curious what other stories folks have or reactions to that.
Thanks, Logan. Yeah, I feel the same way. So having always lived in a large county, this is a problem I really haven't given much thought to, because I think that probably Wyandotte, Johnson, Shawnee County, when you talk about these big Northeast Kansas counties, I think for the most part, the zoning regulation is about what KDHE regulation is. But when you get into these small cities and towns, especially when you can't just readily find what their existing, city planning or zoning is, it makes it a lot more difficult. I also wonder if there's any rules about running a program out of a home that's leased, even if it is occupied, and just cringe at the equity issues that creates, because we know that everybody is not set up to be homeowners. We know that the crisis that we're in right now with interest rates and everything else. So I would be interested to hear if anybody knows of a specific county that doesn't actually allow a renter to run a program out of their home. So even if they're living there, they still can't. And it looks like, so I have a comment in the chat. So Ashley says that there's partners in San Diego who have the same barrier. And definitely, I think it's happening all over the country. We know that there's a housing crisis just in general. So I can imagine that, especially trying to find somewhere that you can run a business out of is just impossible.
Hannah, I had another thought, not necessarily related to zoning, but more to county and city rules. And that is the licensing fees that are specific to counties and cities that they have chosen to enforce on top of the state licensing fees. Some are pretty minimal, but some are pretty substantial. I'm thinking Lawrence in particular was pretty substantial, or might have been Wichita, but I think KDHE has some information about that, but that has been concerning in some of those areas.
Thank you, Jennifer. I appreciate that. I will look into both of those and follow up on it. So you're saying that in addition to their regular licensing fees, they have an extra fee to pay to their local
Yes,
authority.
and some are countywide and some are specifically cities.
Okay, that's very helpful. Thank you. Let's see. So I have another comment in the chat from Amy, and she's talking about how landlords can lose interest due to the change in taxes owed. And I think that's what Logan was kind of talking about earlier. Let's see. We've also had current providers lose their homeowners insurance coverage because of operating a home daycare. Yep, like absolutely. I can see where your homeowners insurance could balk and create a liability argument, which is, again, that's an equity issue. But any other thoughts about this problem or thoughts about how we should tackle it? One of the first things that comes to mind is, for me, is chambers of commerce. For those communities that have a really strong chamber of commerce relationship, we've seen those organizations be able to mobilize around things like healthcare, kind of a co-op model for childcare, co-op model for like shared services for providers when it comes to like accounting or HR services. But again, that's county by county or city by city. Is there any other common denominator that we could use to try and tackle this issue? Okay, well, I really appreciate you all letting me kind of float this with you, and we can and talking it through. As I showed you earlier, this is something that's called out specifically in the strategic plan. It's something that we committed to trying to address. And so I'm excited to see where we can take this. A couple of the products that came out of the early childhood recommendations panel last year, for example, there was a kindergarten transitions toolkit, was a unique solution, providing kind of general guidance for most cases for someone to navigate that process, even if it didn't apply to the specific nuances of their situation. And I think we could do something similar here. Because like I said, just even in my Googling and my being creepy on the internet, I had a very difficult time trying to find clear black and white information about ratios and capacity and hours of operation, even in the county that I live in. So thank you very much, Logan. And this is something that I'm going to continue to bring up with the Quality and Environment subgroup on the Early Childhood Recommendations panel. So if you're part of that, this is work that I think is really relevant. So I look forward to being able to bring this back maybe in the spring and give you an update on any progress that we have been able to make, because it's very important. And I think that people forget about it because it's not licensing. It's just kind of this in-between gap that once they get through all the licensing and the fire marshal and all of that, there's this extra hurdle, and you kind of have to navigate it yourself. So, all right, so just a few reminders for everybody. We have our early childhood recommendations panel meeting December 16th. We're doing our work groups again. So if you're interested in viewing those work groups, we have quality and environments, we have recruitment and retention, and I think it's family partnerships. I'm sorry, I don't know how I spaced that. Each of them are independent YouTube links, so you can actually watch the work group as they break out. We're gonna have a presentation from a professional development provider. And then our next biweekly webinar, of course, is December 14th. We have, and what I'm really, really excited about, so two things before you tune me out. This Friday at our early childhood meeting in the afternoon, which is at 1:30, we are going to softly unveil the career pathway and the mock version of the website that it's going to live on. So we're going to have a really huge update for you on Friday about the career pathway. The other thing that's very important is the link that you're currently on for this webinar is going to be no longer good after December. So if you go into the Kansas Children's Cabinet website, there's going to be 2 links to register for webinars. One of them says register for 2023. We need every single person to re-register with that 2023 link and then add all of those to your calendars. Otherwise, the link that you're on right now will not get you to the webinars next year. We have a Zoom issue, and so this is the best way that we know how to remedy it. So if you have not done so, please make sure that you are filling out that link on the web page where it says get involved, and then you go into the biweekly webinars so that you are getting all of our updates and have Zoom links for all of our 2023 webinars. So that is all I have. And as always, if you have any suggestions for presentations, or if you and your agency want to come and kind of tell us about what you've been up to, we'd love to hear from you. You can always get in touch with me, and I'm dropping my email in the chat. And with that, we will see you in 2 weeks or this Friday if you happen to come to our early childhood group. See y'all.